Welcome back to the Grad podcast. I'm Kathleen Foran, and today I'm here with Jaspreet Sethi from Design for Health. Thanks so much for coming in today, Jaspreet. I'm so intrigued by your collaborative project with Toronto Western Hospital evaluating their new emergency department. You're also the first person to come onto the podcast who's working in partnership with another person in their program. Could you begin by sharing how you came to work together on this?
Thank you so much for that invite. And yeah, definitely, I'd like to share more about my project with you. I'm working with Anna. She's an emergency doc at Toronto Western Hospital, and she got up this idea that we should work together. So actually, it started in summer, where we had this summer course called Colloquium, and we were to come up with ideas for our final project. And both of us had similar interests. She started with doing something for staff spaces at Toronto Western Hospital, where she wanted to redesign those spaces, making the breakout spaces more comfortable and more usable for the staff, because I think those are the spaces that are like overlooked while designing healthcare spaces, where more work is put into design for patients, or where doctors or nurses or staff is going to be. But these spaces, like breakout spaces, are like mostly overlooked at. And she took up a part project where she was going to redo that space and come up with a better solution for them, while I was looking at safety, designing for staff in mental health care facility,
Okay.
because that's one of the critical spaces where staff goes through a lot of trauma, and they are actually they 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 experience a lot of backlash from mentally ill patients, or patients who are going through a difficult time and things like that. So I was looking at ways of designing spaces so that um, that can mitigate the risks that staff is yeah staff is like projected
Yeah.
every day. So yeah, and because both of us were coming from the same point of view, Anna gave in this idea that why don't we do something for the emergency department that's going to be built um, at the Toronto Western Hospital. And yeah, that's how we started looking into it.
And did she knew about the new emergency department because she was working there?
Yeah, she knew about it. Even I knew about it because we had taken up the project um, previously in, I think, winter 2024, no, 23, winter 23. That's when we worked on the atrium project at Toronto Western Hospital, which was introduced to us by our faculty. So we kind of knew that the project is being built. And yeah, that was the starting point to look into more spaces um, that Toronto Western was designing.
Okay, so it was like through other courses that you also kind of came to like build a relationship with Toronto Western Hospital.
Right,
So you already had that
right.
going into the research project.
Yeah, yeah.
That sounds helpful. And what has been your methodology for evaluating the new department?
Mm, so it was fairly simple. We combined a couple of methods together to put together this workshop. We started with uh, evaluating the current ED experience by giving them a survey. And after that, they were asked to undergo the VR experience. Of course, we did like a little tutorial before they were asked to do the VR experience, which helped them immerse themselves in the environment that is going to be built. So the VR experience looked like look like a game kind of a thing. And the participants were asked to perform certain medical tasks that they could perform in the space using this game. And they were able to navigate through the space. And the tasks actually helped them look into how conducive the environment is, or is the space enough for them to perform those tasks, or is the space helping them feel better in that particular environment. And then after that, they were given another survey to fill out, which was based on the current experience they had in the VR for the new proposed design. And then we went in from there we went into semi-structured interviews, which then helped them elaborate if there was something missed out in the survey. So yeah, that was our methodology.
That sounds very thorough. So it was a combination of surveys, a VR game experience where they can navigate the new department, and then also like post interviews.
Correct.
Yeah, cool. And how did you design the VR experience, and what tools or skills did you have to learn?
Mm-hmm. That was quite challenging, I would say. So we already had drawings from the architects who had designed the space. All we did was actually take those drawings and then take it into a gaming software called Unity. I also first worked with those drawings in Unreal Engine, but things didn't go well there. So I had to take it to Unity, which was much easier. Yeah. Then we added a little bit of coding here and there to make it more interactive. And yeah, that was actually that took the most of our time, I would say, especially because we had to involve a lot of medical tasks in there. So like taking the medical cart inside the exam room, parking it in a appropriate place, trying to retrieve patient data from the patient monitor screen, or even like settling the patient inside in a jerry chair, which is like a chair that is part of the exam room where patients are operated. And yeah, some of these kind of tasks. Yeah, and yeah, that's all. I think that was connected to the whole VR it said. So that's that's pretty much it.
That sounds very complicated as someone who cannot code or game design.
Yeah, that was first time for me. Yeah.
Yeah, was that difficult to learn?
Of course, that was so difficult and had like sleepless nights. But then thankfully I reached out to people who were good at it so they could help me with the whole game design bit of it. That was super. Yeah, that came in as like last minute help.
Yeah, to learn new skills, need guidance. Did your background in architecture also kind of help to translate the architecture designs into a game?
Yeah, yeah, definitely.
Okay.
That's what I actually used. I had those skills of reading a space, reading drawings, and already have that kind of knowledge. But all I did was gamify it, and also like think before, right? Like what kind of questions do I need to ask, or what kind of difficulties the patients or the end users might face in the space. So thinking through
Anticipating
and
needs.
yeah, exactly. So that was something that really helped me. And Anna, being a physician, she has been in the space more than I can understand, right? So for her, being on the project really helped because she was able to guide us through the project about what the space needs, or how what kind of equipments or tools are needed in which area, or what are the correct placement like. So those kind of things, yeah, I wouldn't know much as Anna would. So yeah,
Yeah, having that
collaborating really
intimate,
helped.
yeah, having that intimate experience must be so helpful for that attention to detail and anticipating needs.
Right, right.
And how are you and Anna dividing up the project?
So basically, both of us did everything together. It's just that only while we are collecting data, or I would say rather retrieving the data, we're going to separate the work, which is dividing user groups. So Anna took up um, the patient partner groups, and I have taken up the nurses or physician group. So the space was evaluated from both the user perspectives, and we evaluated the same space for both the user groups, but only that the game was different from for each group, because each group has different tasks. So nurses are going to perform different tasks in the same space, and patient partners are going to perform, or rather be in the space and think differently about the space. So both of us have divided the work according to our user groups, and yeah, but the whole game and the whole workshop thing was done together because both of us needed each other's expertise.
Backgrounds,
Yeah,
yeah,
yeah.
yeah. That's incredible. And then what are maybe some of the challenges that you guys have faced during this project?
Um, Apart from the technological challenges, I don't think. I mean, we are still working on the project right now,
Right.
so so
Challenges
far
might come.
challenges might come, but so far it's only been navigating the whole configuration of the VR headset um, while doing the workshop. That's the only challenge that we have faced so far. But I would also say challenges from school, like borrowing the VR headset, yeah, renewing it every day, walking to the university because we wouldn't get like enough extension period to keep the headsets and the controllers. So that was another challenge to add to it. But apart from that, yeah, it's been good so far. Yeah.
That's good. That's good. Well, thank you so much for sharing details of your design project with me today. Um, it's amazing to hear how you're working with the Toronto Western Hospital to improve the conditions for nurses, physicians, and patients. I really admire the work that you're doing, and I wish you all the best for the upcoming deadlines.
Thank you. Thank you so much. That's much needed. We need to cover those deadlines too.
Yeah. Thank you. Thank you for watching and stay tuned for the next episode.